It's Go Red for Women Day today. If you think you're seeing red everywhere and we're all wearing it, you are and we are. We're not only wearing red to show our support, it really kind of got us thinking about our hearts. Heart disease is the #1 killer of women, but #3 is stroke. Dr. Louise McCullough is here from the Stroke Center at Hartford Hospital. She joins us once again this morning. Good morning to you.
Good morning. Thanks for having me on.
Let's start out with a number. How many Americans are affected by strokes every year?
So the number is actually growing because our population is aging. About 800,000 patients a year are affected by stroke, and women have more strokes than men. So there's about 55,000 extra women than men that have stroke.
Every year we do these stories and I feel like I learned something new. I did not know that. Maybe you didn't either. Here's something you know a lot about. The American Heart Association has issued its guidelines for preventing strokes in women. You happen to write them, so you're pretty close to the source.
Exactly.
Tell us about some of these guidelines.
So I was co-chair with Dr. Bushnell and a great group of researchers. We had input from OBGYN, epidemiology, and we specifically wanted to address the gaps that we see in women with stroke. A lot of women don't realize they're at high risk. They don't realize things like pregnancy-associated complications, like pregnancy-associated hypertension or preeclampsia, can increase your risk later in life. So we really wanted to amass a set of guidelines that were specific for stroke in women that primary care providers and doctors could have right at their fingertips. And there are certain things that only affect women, pregnancy being one.
Well, and it's interesting you bring that up. As we were chatting before, I thought, you know, I'm low risk for stroke. I have nothing to worry about. And then I mentioned I had preeclampsia with my first pregnancy. And so if you had that as well, first of all, I'm so sorry because I know what it feels like. But second of all, what does that do to us, for example?
So we now recognize that a preeclamptic pregnancy or pregnancy-associated hypertension doubles your risk of stroke later in life. So not during that time period, even if your blood pressure returns to normal. We see the same thing with pregnancy-associated diabetes. If you have that, you're more likely to develop diabetes later in life. And you should be aware of that because maybe you need screening a little bit more frequently than somebody who didn't have preeclampsia.
So for people like me that thought I was in the clear, maybe you thought you were as well, we need to have discussions with our doctors and do more intense screening, maybe more regular screening, and just at least put it on our doctor's radar screen, right?
Because hypertension and often diabetes don't have symptoms. So you don't want to go years without knowing you have these diseases that are such important risk factors in both men and women, but you may not be aware that you're at risk for it in middle age or just past menopause.
So the one thing people listening that they can take away and perhaps change in their lives or, you know, wrap their arms around to really think, I'm gonna make this difference in my lifestyle, that they can do today to lower their risk, what would that be?
I would say the most important thing is get regular screening for blood pressure. Blood pressure is a tremendous risk factor for stroke, and it is a risk factor that we can treat and that we can identify. But often people don't have symptoms, so you need to get screened. You need to be aggressive about blood pressure control. Your blood pressure should be 120, not 140. 140 is too high.
And sometimes people think, well, I'm close.
Exactly.
I'm 140, 120.
142. No, that doubles your stroke risk, going from 140 to 150.
Well, I remember with the preeclampsia watching the numbers go a lot higher than that. So it's a scary thing. It's something we just need to be aware of and arm ourselves with information. And sometimes we talk about these topics and I think people think, hey, I don't need to listen to that when it doesn't affect me. Sometimes it does affect us. Dr. McCullough, thanks so much for coming in.
Thanks for having me.
Love the red pin, by the way.
Thank
Wearing
you.
red.
Go red.
Exactly. All right, we still have a lot more to get